Hi, today we are chatting with Margareta from the Endearing project. Hi, Margareta.
Hi everyone.
Yeah. So I've known Margareta for 5 years now. We first met when I worked for Margareta as her doula for her first baby. So today we'll be talking about that, we'll be talking about birth, and we'll be talking about nutrition and all the kinds of things that Margareta does with fertility. So over to you.
So hi everyone. I think it's actually 6 years we know each other. I think we met in 2015. Wow. And so I met Rachel because we were looking for a doula. And I think it was very much an important part of my way of thinking about my birth and my birth experience to involve a doula who will support me on my big day. Because I think one of the key elements for me that I know, obviously that was my first baby, my first pregnancy. I didn't know anything about what I'm getting myself into. And then just to have someone who guides me through the experience, but also encourages me and supports me in that experience and making that a memorable kind of lifetime experience. Because one thing is for sure, that will stay with you for life. And I wanted to make sure that I will make the most of it. So yes, I didn't need to convince my husband too much on taking on a doula. I think once I explained to him how a doula operates, so obviously the difference between midwives and doulas, and what like an important supporting role a doula will have in the birth process, I think he was very much on board. And then we've also done the hypnobirthing classes with you. So I think that also helped him to kind of ease himself into the process of his role as my support partner, and us as a trio, how we would work through that birth. So that's how we met.
Yeah, I think that's really important that you highlight there how important Dad's role is in the birth process, because a lot of times I hear mums say, oh, but Dad doesn't really get why, what's the role of having a doula there, and does that mean that he has a different role? And actually we just all work together so well, and it works in different ways. That sometimes it's mum and dad together and I'm kind of in the corner or filling the pool or doing something different, and then other times it's me and mum together, and dad has got himself a practical role. So it all kind of depends on your personalities and how things go at the time, but it's about having a team, isn't it, to support you, that everybody knows what your needs are on the day.
Yes, and I mean, obviously I'm a planner, and as much as you can plan, you will plan. But then again, especially for first-time moms, I think it's important to understand that probably this is like running a marathon, but you don't know what's going to happen, whether you're going to get to 10 kilometers in 10 minutes, or is it going to be 15 minutes, and just to be open to enjoy the journey at some point. And it can be quite challenging, rather than getting to that end goal, because sometimes you just don't know how long it will be. And I think that was one of my biggest learnings from the first experience, is that things can go very much in a way that you weren't expecting, and then you just need to be okay with it, and just get on with the process and focus on your, how you're breathing, how you're getting yourself through difficult moments, because there can be, not all births are straightforward. Some of them are very straightforward. Some of them, you would say you had your fair share of birth stories. Some of them are not, and it can be your first, your second, your third. You never really know what you're getting yourself into. But I think that's where the mindset of how you prepare for the pregnancy, how you prepare for that birth, but also when you're in that birth, what your mindset is just so crucial.
Yeah. And I think it's amazing how much we learn about ourselves during each birth as well. So I know for you, some things came up in your first birth which you didn't expect, and it's kind of going through that process at the time. So when we sort of embark on that journey as a family together and with a doula, we sort of we don't know what's going to come up along the way. So it's so crucial that we're really in touch with everybody who's at the birth. And that's where, again, where having a doula comes in, because you don't know who your midwife's going to be. So when you know that there's going to be someone else there that's just going to be there for you, and and that understands that these things come up, and births change direction very quickly sometimes.
They do, and I think it's really good to have a doula, because obviously in the UK, as we stand today, you never really know who's going to be in the hospital, who's the midwife who you're going to meet.
Right.
And as you might remember, in my first experience, the midwife that we had wasn't necessarily keen on joining this experience with us, and I just felt really disconnected from the midwife. And I was just so happy that I had my little bubble, my support bubble to have there. And there were moments where I was so exhausted I couldn't even express what I wanted, but I had you there kind of seeing that I needed something, so I managed to somehow vocalize of what were my thoughts, what was I needing, which necessarily, I mean, you can have it, don't get me wrong, you can have excellent midwives, and I think majority of the cases they are 100% on the job and they do an excellent work. But it can also happen that you don't have that connection, or they had just this is their third shift and they just exhausted and they can't, it can happen to all of us. And I think in our case, I was in a very difficult position. She didn't really know for how long I've been in labor for, because by the time I got to that room, I was in labor for probably 10 hours, 15 hours, God knows. She couldn't know that because, I was just about to reach around 6-7 centimeters for her. I was just maybe in labor for a couple of hours. So I was absolutely exhausted. And it was just so important to have you on board who knew exactly what I was going through, and then just ask the right questions if I was ready to do something, or if I needed something, or just really advocating for me where I felt like I was so exhausted I couldn't, between surgeries I couldn't talk anymore because I was just so focused on the intensity of what was going on with me. So for those who might be interested, I mean, I had a quite tricky presentation with my first birth. It was over almost a 24-hour labor, starting off with surgeries 1-2 minutes apart, so very intense. And then the baby was, my firstborn basically was head up, and he was supposed to be head down. Rachel will tell you what is the occiput, I don't know what's the medical word for it, but we didn't know that. So basically it's not enough that your baby is facing down. It's really good to learn, facing down but looking which way, right? So that's why we want the baby to be facing down, tucking the tummy, and the spine should be towards your belly. Well, in my case, the spine was towards my spine, which made the birth really intense, really difficult. So it's a back-to-back presentation, which we weren't aware of. So I think Rachel suspected it probably at some point, given that I had a lot of back pain. And then I think I haven't engaged properly until about 6 centimeters or something like. So really intense surgeries, really long labor. And I mean, for your first labor, where you're already going into it, at least for me, I went into it nervous, not knowing what's coming, and meeting surgeries with this intensity was quite frightening, which I don't think helped me, because obviously when you're afraid, you're not breathing properly, the hormones are not working properly in your body. So I think it made everything really complicated. But I think because of your presence and because you kept on telling me that everything was okay, I was doing fine, I just managed to focus on the job that I needed to do. I mean, we can tell everyone, luckily it was a natural birth and it was like a beautiful, experience in the end, but it wasn't an easy one. So I think it was really important, especially you can also imagine from my husband's perspective, it was his first experience as well. And I think whilst we are in it, we can't forget that they are not experiencing it. They just see us going through it, and it can be quite frightening for them, and they could feel very helpless. So I think your presence was really soothing for him, knowing that whilst he's not always sure what his role was or what he needed to do, he knew he could just step away and just get back to us, or just, grab a coffee or go for a sandwich or bring me some food or whatever I needed, or we forgot something in the car. And think if there's just a duo of you, it can be quite tricky, like leaving you there in that position, not knowing, who's looking after you. And for him to be able to step away even just for 3 minutes, gathering his energy and coming back supporting me, I think that was really useful. So he definitely keeps telling me like he couldn't have gotten through 24 hours of really intense labor, not knowing really, we weren't necessarily preparing for 24 hours long, very intense labor where the surges weren't building up. It just, non-stop happening from the first moment. So I think that was really important for us, and we made the absolute right choice to have you there.
Yeah, I think you're absolutely right. Where it's hard for Dad is when things get really intense, and I think for your, exactly as you described, it was a very intense birth, and there are times during that where Dad's kind of lost because Mum doesn't always communicate the way that he's used to. Especially, I find that a lot of mums who want a doula tend to be planners and tend to be very organised. And then when it comes to birth, Dad's like, oh, but I thought, tell me this, and I thought this would happen. And I think it's quite shocking for Dad to see Mum, doing her own thing and flow. And sometimes Dad just needs to hear someone go, okay, this is the process, this is how it's going. And also, it's great that Dad's there because Dad can then say, something doesn't feel right, or I feel like, Mum needs this, and there's all kinds of different levels of communication there. So I think for you it came to a point where we needed a change of situation, and we all kind of picked up on that, and we knew it was time to change things up a bit, but we didn't know why, and it was only in the debriefing as well. I think that's really important as well as in what we do, is to have that debrief process and go through and kind of understand what we've learned from the process and how we came out where we did. So I think that for us that was really important, wasn't it, to go over
it was
what we learned.
It was because, whilst I think looking back at it 5 years later, I think I made my peace with the process. But for I think a year and a half within that, after the birth, I still had like so many questions and what could I have done better, because it still was like quite an intense birth. And then I in my head I was going to be able to give birth in water, and in the end I couldn't do that. But also there were so many reasons why I couldn't, because it brought up my own childhood trauma, which I was completely kind of unaware of how much it impacted me, and I was almost drowning as a child, and being in the water going through birth, it brought up a childhood trauma which paralyzed me at the moment, but it all took time kind of to go through that process afterwards. But also because my waters never broke, the presentation of the baby wasn't ideal, I was exhausted, and then she was coming down obviously in the sac. So for my body to be able to birth a baby like that at that stage after 20 hours of labor, it was almost impossible. So it all kind of prolonged the process of going through the exhaustion. And I think it was really important for us to kind of sit down, and because I experienced it from my perspective, but someone who's been there and seen it happening and telling me that, you did everything you could. There was nothing where you made a mistake, especially for a first birth where you have no idea what to expect. And I think most women, as I said, go into it with some sort of fear of what ifs, and we have, I think also we put so much expectation into the process, like because you are waiting for this baby, you've been waiting for so long, you might have been waiting also because the pregnancy hasn't happened, but if it happened, then obviously all the worries of miscarriages and fertility and infertility. So there's a lot of thought going into it, and then 10 months of pregnancy, so you are expecting some sort of amazing feeling and euphoria, and everything will go as it planned. And I think probably 80% of the times it don't. And especially hearing that other moms are also planners who are having you, I think it's also like almost like a perfect birth plan issue. Like I know for myself, I'm a very A-type personality, so I like to plan, and then the birth story, my own birth story, kind of taught me that it's really out of your hands. Like, you need to let your body know what to do, and getting into a completely different mindset, because the more you switch your brain off, the more your body gets into this, it's not really the right word, but kind of this animalistic instinct-led mode, and that's where the magic happens. But for you to be able to get into that mode, you need to forget to think, you need to forget, you need to shut everything out. And I think for first time when you do it, it can be really challenging. So going through the process afterwards and analyzing what happened, I think it's also very important. And I know that women can do that. I don't know if many of women who've gone through, difficult births or even birth traumas know that you can actually discuss your notes with midwives as well, retrospectively. And I think that's a really interesting and important right we have. And I think if you feel, any of you feel out there that you need to have a closure or a better understanding, by all means, I think they need to keep the records for quite a while to be able to go back and discuss that. But I was lucky enough to have you there, so kind of had that sort of external view on what have happened. Sorry, I think my neighbors are drilling again in these unbelievable hours of the day. So
yeah, I agree. And I think even if you can go over your notes with your midwife, what we experienced and what you've mentioned there is that we had shift change going on, and again, so it's getting the consistency. We can't always get that consistency, and having a doula there gives you like the way to put together the picture of what's happened, and so that you can go through the process. And I think that's really important. But like you say, so many things come up, and sometimes for a planner, and I'm a planner as well, so I get what it is. It's almost like you have to plan and you have to schedule in that time to actually let go. So if you don't schedule it, you can't let it go almost. So I feel like, when you arrived there, for you personally, and you had to let it go, it took you some time to unwind into that scenario. But when you did, obviously, you obviously got the outcome that you wanted, and that I mean that was a lot of determination on your part, and it was fantastic. And I feel like you had a great encouragement team going on there, and I think that you drew strength from those around you. So I think it worked really well. But then having the opportunity again to kind of debrief and go over everything was just really important. And like you say, it might not happen right away. So if you had the year and a half, you had questions, everybody's not ready to address things straight away, and that's okay as well.
No, I think it's also not very evident that what you are having is something that could be post-traumatic stress, or that could be classified as trauma, in some instances, because what happens in hospital, by some women, it might be judged as normal. But then again, if they feel that it wasn't normal, or it was frightening, or it wasn't exactly the outcome they wanted, I think it's just important to know that, whatever and however they're processing it, it's not always evident that those are the feelings that are there, and then they need to address it. And I don't think that I actually started to address those feelings until we started to plan for a second child. And I was thinking, okay, I really want a second child, but I'm not sure I can go through this again, because the intensity of it was just so much that it wasn't the type of birth that you would want to repeat. And however the magnificent outcomes, and it was still a win, my body still remembered of the effort that it needed to put into it. So I knew I had some work around that, and very consciously started to work on it. And I think when we decided it was time for us to have a second child, it happened almost right away. So we were very blessed and lucky. And then I think I needed to let go of my expectations around, again, what happened first time around. And I think the fact that we had the debrief and we went through, and again I called you and I said, okay, we would like to have you again on board. I just knew, you've been there first time around, you will you got my back, and I don't need to worry about anything. And I think second time around I was even more conscious on focusing on the things that I think were really important. And because I knew I had a positioning issue, I did my absolute utmost everything to be able to open my hips and make sure that the baby has enough space to descend in the right way. So it was from yoga to chiropractic sessions, like very, very, deep squats and hip openings and everything, obviously within the medical kind of safety of things. So all these practitioners who were supporting me, they were qualified to do so. And what I knew, for me to kind of go through this and make it easy, these are the things that I need to focus on more. Because again, I can't stress enough that it's not enough to have a baby that is facing down. But I don't think that when you go to your midwife appointment, they're necessarily talking about this. They are happy just to tell you that the baby is facing down. But because most of us are doing...
They don't always know which way their head is bent as well. And that can be not evident till later. And even during birth, baby can turn. So that's not something that tends to get discussed at the antenatal appointment is which way, whether baby's posterior or not. So that is something that can come as a surprise. It's something that we learn to spot as a doula. Kind of, you get the idea of what might be happening. There's certain things that happen within labour. It might be a really long labour. It might stop and start. There's kind of clues that you can tell. And there are things you can do during labour to actually turn baby, but unless you know, these are things that come with experience, and when you're on a first baby, it's a case of letting go and trusting. I think for you as well, that's something that the second time, the instinct, I feel like you just tapped into your instinct, and it's all the work that you described there as well. It's so evident that you had done that, because you were able to just close your eyes and you just knew everything that was happening that time. It was so in control of that whole situation. I feel like you just I feel like that's how come you got the outcome that you did. And I think that was...
I felt like I prepared for a marathon, but I got like a sprint out of it, basically. Because we're also so just a quick kind of recap on my second experience. So that was completely the other way around, and everybody says like usually the second births are easier, but I think for months and months and months of preparation, I really prepared like an elite athlete going for a marathon. And by that I mean, like, mentally I was visualizing the birth. I had like images of the perfect baby position in my living room, so every time I went to wash my hand or to the bathroom, it was on the wall, the perfect baby presentation in my pelvis, as we learn, like chin down, back to belly, or was it back to belly? No, back to belly, isn't it? It's just the perfect baby presentation, which side the baby should be looking at. So every time I went to the shower, I was visualizing it. Every time I was doing my yoga poses, I was visualizing baby, engaging and coming down. And I was doing, I think 3 or 4 weeks prior to the birth, I was doing extra kind of yoga poses that enable the baby to move down and be in the perfect position. So little did I know that it really worked, because I went from 0 pain to literally 10 centimeter, I think probably within 2 to 3 hours. But I think it would have been even faster if I wouldn't have to need to get into car and get to the hospital. But I was really lucky that you heard me on the phone, because my husband phoned Rachel, so it's part of the story. So I was in labor. My husband was kind of taking our firstborn somewhere, and then I needed to phone him, like, this is really ramping up very quickly. My husband, he was like, well, yeah, I shall get home at some point, because he just thought, first time it was really long, so I have a lot of time he wasn't really worried, but I kind of knew instantly, like, this will be really quick. Like, I couldn't believe how quick, and it was really like almost painless, to the point where I was like, is this really happening? And it's just some point it just hit me, like the surges, and then I knew, like, okay, this is really intense and we need to get into the car and I need to get to the hospital. By the time he got home, and I was texting you like, this is happening, and you got ready because you kind of knew, okay, okay, because this is really happening. So you packed your stuff up, and then we were still hesitant whether you're gonna come to ours, and then we just chill out a little bit before getting to the hospital.
But I was already. I was like, I'm on my way.
You know, like, okay, we need to be in hospital, but my husband was kind of like, no, come here first, and let's go to the hospital. And luckily, you pulled over, kind of had that instinct of calling him again, and then you heard me being in labor in the background, and then you said to him, no, you're going to the hospital. And finally then he believed me, because I kept on telling him, like, we need to go. Like, in between surgeries, my surgeries got like really so intense that I was like, this is it. And he, because of our first experience, because he's seen me for 24 hours, he thought like, no, let's call Rachel home and let's have a tea and then we go. And luckily I still remember the moment. So my surgeon stopped in the car. I'm pretty sure I would have given birth in the car, because it's just happened so naturally. And then that relief to see you at the hospital waiting for us, I just knew, okay, I don't need to talk from here now. You just literally, I don't even remember. I just remember holding on to you as my husband was parking the car. I just held on to you. I remember the ridiculous questions at the desk where, like, they asked me to, you know, like, oh, take this box. So that was, I'm like, I'm gonna give birth here. Like, I can't really talk. I can't really answer any of these questions. Just get me a chair or something. Like, I really need to get on with this. And I remember this guy was doing this check-in. He just didn't get it. And then were people coming by, and I was like, I'm really sorry. I'm gonna have a surge again. It was just so intense. And then even the midwives, as we were waiting, I remember I just sent my husband out saying, no, Rachel's massaging me. It's best for you to wait outside, because you just really know where those pressure points were to get me through that kind of, I don't even know. It felt like ages to wait there, but finally I've been seen, because they could tell my voice that I was bearing down. And I think from then,
at that point, they tried to send him, and I hid him around the corner because I said to him, they said, oh no, you have to go out to the main hospital. And I said, if you go out to the main hospital, you're going to miss this birth. And he was like, what should I do? And I was like, wait here. And I sort of ushered him into a corridor and was like, wait, I'll come and get you. And then, oh my gosh, I'm so glad we did that, because when they realized how far along you were, they were like, run.
I mean, I still remember, like, I was probably around 7-8 centimeters, but I thought, okay, if this is going on, like, I can't carry on. I will get an epi, you know, I'm geared up for another 10 hours. And then the midwife looked at me and she was like, you're not gonna an epi, you're gonna get a baby. I looked at her like, and then I really remember that sentence when she said, like, do you listen to your voice, like my own voice? She's like, yeah. And she's like, where is it going? And I said to her, like, downwards, like, and she's, you're bearing down, you need to push soon, so we're going. And I think just that for one moment, like one woman to another woman, when she looks at me and she told me, like, basically she told me, you can do this, you're already doing it, this is happening. And then I remember you grabbed my husband and literally they just put me in this chair, and we got into the room, they got me on a table, and I think 20 minutes later my second daughter was with us. It was just so quick, there was no time for chit chat or anything. And I think we got really lucky this time around, to brilliant midwives, and everybody just, it was really the energy, everybody just knew what they needed to do, where they needed to be, laughter, and, you know, kind of everybody knew I was going to get there very quickly. And before I knew, she was there, and I remember holding her. I was like, wow, this was really different, this was really different. And that felt really like a super victory over kind of overwriting everything before, thinking, okay, no matter what, you need to trust your body, because it always knows the way. And somewhere along the way, we're kind of losing that trust and knowledge. And I think we just need to really get back to the basics when it comes to giving birth. So yeah, interesting, two completely different stories, but luckily enough, it was all, you know, it was all great at the end, and great experiences. So.
And I think you've touched on something there that we talked about earlier before we started recording, which was about getting your mindset, your mind, you know, it's so important for your mindset to be in the right place. And that's something that you cover in your business, isn't it? And get people getting pregnant, getting their their nutrition right and their body in the right place. So do you want to talk to us about that?
Yeah, sure. So basically, I'm running a health coaching business, which is called the Endearing project, and I became a health coach 5 years ago because of my own health struggles and fertility struggles. So I was diagnosed 10 years ago with endometriosis, and for those of you who don't know, it's a condition where tissues that are almost like your uterine lining. We have now clinical proof that it's not exactly the same tissue, but very similar to your tissues in your uterine lining are actually wandering around your pelvic area. And then they are causing all sorts of health issues because they're reacting to your hormones, they are bleeding on their own, so that blood can't get anywhere else but your pelvic area. So that can cause cysts and adhesions and scarring, and imagine just like Play-Doh basically gluing your insides together. And I think it's a very under-researched disease and condition. They don't really know why it's happening to some women, predominantly women, although it's been found also in some men. I said predominantly in the pelvic area because it can go up to your brain, to your eyes tissue, so all lung tissue, so it can be everywhere, but in most cases it's in your pelvic area. So I think it's important to talk about it because it's not necessarily well researched, and it's just as prominent as diabetes. So 1 in 10 women around the world are having this condition, and just as many people who are living with diabetes at the moment. Yet we hear a lot of people talking about type 2 diabetes, but we're not hearing people talking about endometriosis. And I think for a disease that is touching so many women's life, like I'm 1 in 10, but I know many of my friends, ever since I started to talk about this openly, that are suffering from this condition still not have a cure or guidance, or apart from the very traditional and sometimes not accurate medical practice that is, the standards that been built probably 20 years ago when they started to treat this disease. When I was diagnosed, I just felt like that's not good enough for me. And I was amongst the lucky women who've got diagnosed quite quickly, because I know it can take on average 7 to 8 years to get diagnosed. So you're going into a really heavy period, you're going through really painful periods, painful intercourse, painful bowel movements, everything can be related. Some of the times we're not getting diagnosed with IBS in the same time with endometriosis, there is a clinical connected, like they are connected, but they're not exactly, like they're not the same conditions. So you can get misdiagnosed as well. And when I got diagnosed, I was told, okay, so I had cysts in my ovaries, which were visible via a scan, a normal scan, which is not the case for everyone. If it's deeper in your tissues, in your pelvic areas, the scan won't show them. So the only way they can look is via keyhole surgery. And in my case, it was very visible. They didn't know what other areas of my organs were damaged, but they were sure that my ovaries were damaged. So they told me it's probably a stage 4, which can be the worst stage of endometriosis. So just like cancer, it has stages depending on how deeply penetrating and infiltrating the endometriosis is. So I was scheduled in for surgery, which would have meant that they would need to cut out both of my ovaries from the inside and look for healthy tissues, so preserve the healthy tissues and take out the bad ones, because they were so big, they were fearing that they might burst, and that would cause bursting of my ovary potentially, which would cause internal bleeding and I could die. And it was the case for both of my ovaries. So the doctor looked at me and said, well, given that I can't see any healthy tissues because these cysts are like pushing out the healthy tissues, he said to me, he doesn't really see a chance for me to actually have living cells, like living eggs, like any tissues that can produce eggs. Wow. So I just did feel a little bit, obviously there were 2 different doctors. So I'm from Hungary, so I went back there to get private care. And I know this is not a privilege for everyone, because here in the UK, if you depend on waiting lists and medical opinions, you don't always have the chance to get second opinions, and you don't always have the chance to be seen directly. So I was really extremely lucky to be privileged to go back to my hometown and get these examinations done, because I just felt like the pain became so prominent. I needed to get checked out. So I've been seen by 2 different doctors. They considered at some point ovarian cancer because they weren't too sure. Then obviously gone the blood test, and because of my age and the results, they ruled that out. And then I was scheduled for surgery. And then I asked from this doctor, I just said that I don't feel comfortable with doing this surgery right now. And he said probably I have 1, maximum 2 months before these births. So he would definitely advise me to go through with the surgery. And I was quite angry with that kind of conversation. And I appreciate, as a medical doctor, as a surgeon who's been trained to cut, and that's their way of curing a disease, that was probably the right protocol to offer. But I just felt like it wasn't really connected to my personal values, of my way of healing, and I just knew it wasn't the right choice. Something inside of me just said it wasn't the right choice. And I think it's really important for any women out there who just at some point on their fertility journey, they just feel a little bit of doubt, thinking this is not the right choice for me, whether it's during, you know, fertility journey, IVF, conception, pregnancy, birth. I think there's always the best what to do is just to step away a little bit, sleep on it if you can, and then just listen to that. Is it fear? Is it reality? You know, what's going on? Why you feel like you're not okay with someone telling you what to do or with their proposal. And I think in my case, that was like probably the first crucial step that I took for my healing, is to step away. And I was lucky enough to go to a 3rd doctor who was actually having a much more holistic view on this condition. And I was so lucky that I got to him, because he looked inside of my uterus and he looked inside of my ovaries and said like, well, yeah, this is bad, but this is not as bad as I've seen in some of the cases. So certainly you are in trouble, but it's not as a big trouble as you might think at the moment. And he said to me, he gives me 3 months, which was obviously music to my ears, of somebody who doesn't want to go into me, inside of me, and do like some sort of invasive surgery and then stop my period with artificial hormones, but who said, okay, what's your choice here? And he was the first person who ever taught me to think about my feelings, because he asked me the questions which I wasn't expected from a medical professional. How do you feel in your relationship? How do you feel at work? Does it, you know, are you connected to your work? Is it in line with your life purpose? And at that time, I really didn't like my job, and I was really overstressed and overworked. And he said, usually when he sees patients with this condition, those women are very much disconnected from their creativity, and it's either linked to their personal relationships with their partners, their femininity, or their creativity. So those are the areas, he said to me, just focus on these. And I was thinking, oh my God, like it's incredible. Like this makes complete sense to me, that, you know, what's happening inside of my body is not a disconnect from whatever is happening with me in my life. And I walked away, and I just said to myself, okay, so you got 3 months. And take this very seriously. So I read all the medical articles I could find, all the research, I think I was on it for hours. And then I just decided, okay, I needed a lifestyle change. This is what I'm doing right now at work is not me. I need to change my job. I need to be happy, and I need to feel fulfilled. I need to be more connected to my own purpose, like what matters to me in life. And I need to stop eating sugar, and I need to, you know, cut out certain things from my diet, which clearly are causing inflammation. So I think that was the first call of action. Like I made a little plan of what I'm going to do. And I don't think I did it perfectly. I don't think I did it exactly how it was expected from me to do. But very, very quickly, my body reacted to whatever I was doing. So I was doing daily visualizations that my body was like destroying these cysts, and they are shrinking in the morning, in the evening. So I had this practice when I'm going to the toilet at work. I'm just going to do, you know, however long I'm there, whilst I'm washing my hands or whatever. I was thinking my body is working on destroying the cyst, and I'm healthy and I'm happy. And I did that all along with all the other lifestyle changes. And in the meantime, I signed up for IIN, which is the Institute for Integrative Nutrition, to become a health coach. Because I thought, oh, if this is working, which was proof that it was working, I think a month and a half after I flew back to do another scan, and the doctor looked at me like, what are you doing? I'm like, what do you mean? Is it really bad? He said, no, I can barely see them. You know, they're shrinking. They actually started to shrink. I was like, are you kidding me? He said, no, whatever you're doing, keep doing, girl, you go. And she's like, oh my God, like this is working. This is really working. So I kept on doing it, and I graduated as a health coach, and it just kind of felt like this is my purpose. Like this is what I want to do. I want to help women to feel better. I want to help people to learn about how to look after themselves, but not just in terms of diet and movement and sports and all that, but the mindset part of it, of visualizing and imagining that you have a healthy body that is able to do whatever it has to do, whatever it was designed to do. So everything just, you know, I probably, if I don't get this diagnosis, I don't know if I would have been put on this path of becoming a health coach, because I was always interested in doing healthcare and health related things. And as a child, I was fascinated with the human body. And up to 18, I was actually was prepared to do my A-levels in biology. And then somehow around that time when I went to uni, it just, you know, it's all nice, but I'm not sure I want to be a doctor. I'm not sure I want to be a biologist. So I'm going to do something completely different. And then suddenly life called me back on this path to do this. And I think as much as nutrition is definitely a key part in becoming pregnant, and a lot of people are talking about it, there are a lot of programs out there that you will find on nutrition and how to prepare for fertility. I think more and more we recognize there's a mindset element to it. And by mindset, I don't necessarily mean, oh, if you see it and you believe it, of course you will be given, because I think it's much more complex than that. And I know that many women are struggling, you know, getting pregnant 5-10 years, and miraculously it happens 10 years after, and they work really hard for it. So that's not what I'm saying. I think what I'm saying is that I truly believe that somewhere deep inside of us, we have this ancient power of healing. It might sound a little bit voodoo for those who don't necessarily come from this mindset, but I really believe in that. And I think I've proven that, you know, with my first pregnancy and my second pregnancy, that it was an essential part of self-belief and letting go of emotional trauma and whatever work I had to do with myself, because there was a lot. And I think everybody has their own baggage, and everybody has their own kind of karma and life that they need to untangle. And it's not easy. And most of us haven't been given perfect lives or perfect families or perfect, you know, conditions or relationships, or we have suffered, you know, in so many ways. But I do think that when it comes to fertility and health and women's health in general, women are very intuitive, and we just know intuitively what's best for us. So that's why I'm working with women on this journey. And it's not just about fertility. I think if it's all about just feeling better in their own skin, knowing what's good for their body, it's all about, I'm not doing anything, the work is done by them, because intuitively they will learn what's best for them, and then they will never forget that learning, because they will just feel so much more connected to this inner goddess with the wisdom inside of them, that they will just never want to live another life anymore. And I think fertility now more than ever, it's very much a key kind of aspect of being a woman, and we can see how many women are struggling. And I don't think it's also you know, by chance that it happened right now, because I think we are much more disconnected now from this feminine power than we've ever been before. Like the expectations on women and men as well, you know, the energies of how they are transforming. And I talk to a lot of men, including my husband, they don't really know either, you know, where to go on this way of this brand new world, and they feel disconnected from their male powers and male energies, and we feel disconnected from the female energies. And I think the more we manage to get back to that healthy state where we're connected to real food, real drinks, real lifestyles, being out in nature, how we've been designed to live really life on this planet, the more you realize, like, this is not rocket science, you know. If I'm not putting the right food in, if I'm not putting the right thoughts in my brain, if I'm not, you know, sleeping enough, if I'm not moving around to get my blood flowing, but I'm sitting 10 hours in front of a computer, so there's no blood flow around my pelvic area, all these things are happening, you know, the chemicals that we are putting in our bodies, the hormones, the antibiotics. So yes, so I think this is kind of became now my life purpose, to teach women. I don't like to use the word empowering, because that would kind of suggest that they don't have the power. So I always say this is not empowerment. This is companionship. This is a kind of guidance on a journey that you already know you need to be. And I'm just there to kind of help you to choose your own path, and then meet you on that path wherever you are, like a silent companion. And I'm talking only when you need me to talk. But I think mostly people who come to see me, they already know that they have a little bit of work to do, and they just intuitively feel that we are a good match. So yeah, my own story and health struggles definitely led me to who I am today. And you've been a massive part of it, so thank you.
And you've been part of mine, because you know, it's amazing like how well we've worked together, and you know, there's been times when things have flipped on its head, and I've been coming to you with different concerns, and you've been able to, I mean, your knowledge is just immense. Like I couldn't come to anybody else and expect to get so much information, and it's just been mind-blowing. You know, how much you know, and about just nutrition and what's needed, and you have a real gift for knowing, even though you're meeting us where we're at, and you're doing it that way. You've got this kind of inner knowing of what it is that we need. It's a real gift.
Thank you. And yeah, so I don't know if I actually told you, but I embarked on a different journey again. So now I am going to be functional medicine practitioner as well, which is another 2 years of training.
Okay.
So it's even like kind of an even deeper understanding of the human body, and that will include supplements and blood tests and really hardcore medical kind of base training. Obviously this is not medical school, but functional medicine practitioners are really well trained to kind of look at human bodies holistically and put every little piece of the puzzle together and be able to analyze the interconnectivity of the human body and what is going on, and support clients on this journey. So I'm in this non-stop learning and in this geeky mindset of I'm really, really passionate about this. And then I've just started it. So it's a 2 years, year and a half journey, depending on how fast I will be able to complete it. So I'm really excited about that.
Oh, wow. That's amazing. Yeah. And I think that's the way that things are going to go, because I know we're not kind of necessarily predicting what's going to happen here with our healthcare and things like that. But I feel like there's a real push to take responsibility for our own, and I know that's come across in your story really well. But I think as women, you know, and looking at fertility, there's a real need here to take responsibility and not expect for answers to come on a plate. We really need to take our own responsibility, take a look at the whole picture, and work with professionals as well where we need to, who are going to be able to work with us on a specific level, because there's no one size fits all solution for fertility and health issues.
Yeah, I think it's crucial to recognize the need for medical interventions, and it's crucial to recognize the amazing knowledge that people who have been training, you know, for decades and 15-20 years, they know when they need to go in and do an intervention. And I mean, medical science is like more advanced now than ever, and then just look at the amazing work that they're doing on the field right now to save all of us. So I think we need to pay the credits where you know, where they do. And as you said, I do truly believe in complementary healthcare. And then I do think that a lot of practitioners out there who are really, really rich source of knowledge, who can actually help people sometimes much better, because simply we have the time, we have the training to listen to people, to understand what's going on in their lives, and then accompany them really on that journey. But sometimes you see that GP practices are so overwhelmed, they have 5 minutes to see you and they don't necessarily be able to go to the root cause of your problem, whilst a health coach or a functional medicine practitioner, they are. And I think sometimes they're also really good examples of GP practices where you have the whole holistic healthcare, where you have other practitioners helping and working with the GP. And then my dream is that everywhere in the UK that becomes kind of the norm of health coaches and general practitioners working together, because I think that's really in the interest of all patients to have the holistic support. However, if you need medication or medical intervention, you've got a really smart medical professional, trained medical professional who's licensed professional, who's there also to help you. But I think most of the diseases we're looking at today are lifestyle related. So there's only so much amount of medication you can take before you understand that you need to take your own steps towards your own health. And I think type 2 diabetes, pre-diabetes, those are specifically very prominent issues where you see that lifestyle, and with lifestyle intervention, you can reverse diabetes very easily. But if you let people go on that course of continuing the current lifestyle that they're living, then the repercussions on the NHS in terms of costs, and obviously repercussions on the patient's life, which will be a much reduced life quality. I mean, that's a really good example where you can see how already health coaches started to work around the UK to do the NHS diabetes prevention program. And I think that cooperation, is working really well. And then we can see in the pilots the benefits for the patient. So I really believe that this will be the way forward.
That is a great dream for the way of health and well-being going forward. I think that'd be amazing, just to have all of that time and resource available, because there are people like you out there doing these things, and just to know that's available and have that readily available would be incredible.
I think so, and I think that will be the same probably in terms of the care for women who are going through fertility treatments or who are getting pregnant. Hopefully, I have seen some ideas floating around reform of the care that women would receive under their midwives, and then they're trying to now attribute the same midwife to the same patient. So that would be like the quality of care would be obviously much involved. And I think doulas more and more are getting recognition from the NHS as well, from within the NHS, kind of understanding the important yet very different roles the doulas are playing. And I think, I would say that's an integral part of being a holistic health practitioner, knowing that a midwife and a doula are not the same thing, but they all have very important roles to play within that birth experience. And I definitely see that, everything what's happening right now is kind of proof of there's no one size fits all. And then the more we open up the field for other players, the more we serve the patients, and obviously within the guidelines, because all the doulas must be certified, and you need to have certain hours of training, and that's the same for health practitioners, health coaches. You need to be regulated, you need to be certified. So what I would say, anyone who would like to work with any holistic healthcare practitioners, obviously do the background check and make sure that these are qualified people and they have the necessary hours of training, and then they are practicing within their scope of practice. But apart from that, I think that's probably the best decision you can make for your own health, of inviting people on your kind of helping you on your health journey and fertility journey. And I think it's just really important.
Wow, I think we put the whole world to rights with this conversation. It's amazing. It's great, and I hope that people begin to discover those resources being available. And yeah, if you want more information on what Margareta and what I do, we'll put links underneath this chat so that people can find us and find out more, get help for your situation.
Yes, I think there's always a beginning to this journey, and then it's nice to have a chat with people, and then you can figure out whether that's a good fit or not, but you can also give them the information that they need to kind of make their own decisions. But it's all about helping people and lifting them up. So yeah.
Oh, well, it's been lovely speaking with you today, Margareta. We're gonna end the recording, and thank you so much.
Thank you.